Around 1 in 4 of us is overweight. Naturally, it can have an effect on our health. But a heavier population has other consequences too, as Emma Thomas reports.
This is Keith Jago. He's come to his favourite football club in Brighton for a one-to-one weight management programme with Jack Newnham from the charity Albion in the community.
Very slowly. It's good. And turn.
Like many people in the UK, Keith's weight is now at a dangerous level. He's classified as obese and is at risk of developing diabetes. For Keith, it was a wake-up call.
Was it a shock to realise that you were kind of classified as obese?
It was a profound shock. It was awful. It was the realisation that my blood sugar was at a dangerous level that really made me take notice and say, I've got to do something.
If he can lose just a smallish amount of weight, 5 to 10% of his body weight, then his chances of developing diabetes are going to be massively reduced.
More than half the population here in the southeast is classified as either overweight or obese. And obesity is on the increase. It's estimated the NHS spends over £6 billion on obesity-related ill health, and that the cost to wider society is £27 billion.
We have got past the stage where obesity is a ticking time bomb. The bomb has gone off.
And Tam Fry says even if you didn't know about the cost, there are plenty of warning signs that obesity is becoming a real problem.
My particular concern is when the fire service is brought in to help the NHS by winching people out of their homes and taking them to hospital. And there you have a real decision of conflict where the fire service is there to put out fires, not to drag people out of their homes.
Over in Maresfield is the Service Training Centre of East Sussex Fire and Rescue Service. They've had to invest in new equipment and training for rescuing obese people.
This is our training room and one of the standard dummies that we use to train for larger size people. If you just want to test the weight.
So this is the kind of size of the people that you have to deal with.
So it is quite significantly heavy.
Oh, I cannot even lift it.
Yeah, it's all about technique.
So how do they go about rescuing an obese person? Matt's going to show us how it works with their new equipment.
Essentially, I'd get it prepared in that kind of configuration, remembering it's all about technique rather than actually lifting. Pull the handles into place so that, again, working as a team and get the casualty out. With this range of equipment, we've made life a lot easier for ourselves. It also provides a really good level of dignity for the person that we're actually rescuing.
Let's go down and back up. Nice.
Back in the Seagulls Stadium, Keith tells me he used to be really sporty, but his weight crept up after a back injury.
Straight out.
So what have you got here then?
I've got memorabilia from the London Marathon, 29th of March 1981, and there is a picture of me. I'm hoping that perhaps I can get back to running.
Another way of dealing with obesity is bariatric or weight loss surgery. Goldie Kerrer is a specialist surgeon who fits gastric sleeves.
You make the patient's stomach into a banana shape, which restricts the amount of food that they can eat.
Bariatric surgery was the route Louise Eaton had to go down. She was 18 stone, but because she was blind, she found it difficult losing weight through exercise. She tried to get the surgery on the NHS, but ended up having to pay for it privately.
I just fell out of love with myself, really. I felt sad and I had low self-esteem, and I just felt like I was holding myself back.
Her case is increasingly common. The number of bariatric surgeries linked to obesity has dropped since 2012 by more than a quarter.
A lot of people regard obesity as a personal, self-inflicted problem, and therefore they ask themselves, why should the NHS pay for individuals to become thin? That is, in my view, a stigmatizing and totally erroneous approach.
Goldie Kerrer says performing the surgery means the NHS doesn't have to pay for a range of other obesity-related conditions.
So we're trying to avoid diabetes, avoid heart attacks, angina, joint issues, back pain, chronic issues costing the NHS billions of pounds every year.
Bariatric surgery has been shown to recoup all the money on the surgery within 2 years.
An NHS England spokesperson said bariatric surgery is no substitute for also taking effective action to cut obesity in the first place. There are a number of other treatments and lifestyle approaches, including the NHS Diabetes Prevention Programme, which together can support good weight management.
Hello, John.
Another sign that there's been a rise in obesity can be seen at this funeral directors here in Medway. They're having to deal with the increased costs of the number of larger bodies.
This particular room was 2 chapels, and in order to accommodate the larger coffin, we had to carry out building work to put it into 1 chapel. We had to make the doors bigger, simply to allow us ease of access. Again, it was a necessity.
It's not only the building that needed to be made bigger.
This is our preparation room, and as you can immediately see, for comparison, we have a standard size coffin that we would typically use, and here a coffin that we would use for someone who is obese.
I'm really quite shocked at the size difference. How big are the people that you're dealing with?
Years ago, to have someone come through a funeral director's doors who's 37 stone, it would have been unheard of, frankly. The largest person we've been called upon to deal with was just 38 stone.
Are you surprised at the number of cases coming through your doors?
I'm shocked by the numbers that we're now doing compared with 5-6 years ago.
The government is failing hugely. We have, in the 20 years that I've been doing this job, not seen one sensible document about actually getting over the problem of obesity.
However, a spokesperson for Public Health England told us, "We're working with industry to make food healthier. We've produced guidance for councils on planning healthier towns, and we're delivering campaigns every day, encouraging people to choose healthier food and lead healthier lives. It's taken many years for us to reach this point, and change will not happen overnight." Meanwhile, back at the Brighton and Hove Albion Football Club, it's time for Keith's moment of truth.
Keith, you've done brilliantly so far in losing 1 stone and 5 pounds. And what I've got here is a weighted vest which weighs exactly 1 stone and 5 pounds.
Oh, wow.
So I'm going to get you to pop this on now. So that's it. That one in there, that one in there. Oh, okay. How does that feel?
Oh my God. That is enormous. That's really only 1 stone and 5 pounds.
1 stone, 5 pounds.
Wow. I'm horrified.
Have you noticed a difference in your day-to-day life?
Oh, very much so. It's far easier to move around. One's got more energy. It's a dramatic change.
He still has a little bit more to go till he's out of the danger zone. It's a very good start. And according to health professionals, the entire country needs to follow Keith's example and lose weight.
Emma Thomas reporting.